Most breastfeeding women know the many kinds of breastfeeding positions that exist. However, what many women don't know is that certain breastfeeding positions are superior to others when it comes to particular situations, such as when your baby tends to be really gassy, is suffering from reflux, or when you recover from a C-section, a tear, or an episiotomy, or when you have twins, right?
Exactly. So in this video, we are going to share with you the 6 best breastfeeding positions, and we're going to tell you exactly how each position can help you with the situations that Mathias just mentioned.
Yes, this is Nathalie, a pregnancy and birth consultant and TCM therapist.
And that's Mathias, a researcher and science geek, and we are here to help you and your baby naturally and science-based.
So let's talk about breastfeeding positions. First of all, please note that in this video we do not show you how to establish a good latch, because in order to do that we would need a real baby, right? Unfortunately though, we have not been able to find anyone with a real baby who would be willing to help us produce this video. So we just try to do our best with our baby Paul in the hopes that you find this video helpful. So let's have a look at our first breastfeeding position.
For the cradle hold, you first need to get into a comfortable sitting position. Place your arm under your baby so that the baby's head lies on the crook of the very arm, which is on the same side as the breast your baby is feeding from. So the crook of your arm supports your baby's head, and the arm itself can be supported by a pillow if required. The other arm supports your baby's buttocks. Finally, please make sure that your baby's head and their body are in a straight line, otherwise it might be difficult for the baby to swallow.
Yes, for most women this is the most comfortable position once the baby is nursing well, also because it's very comfortable for bigger babies. However, it might not be the most comfortable position if you recover from a C-section, a tear, or an episiotomy. On the other hand, this position could be a good position if your baby is suffering from reflux, because it allows you to keep the level of their head higher than the level of their belly. And in such positions, you make use of gravity to support their digestion. And this is exactly what you want to do when your baby does suffer from reflux, right? For the same reason though, it is not the best position if your baby tends to be very gassy, but we'll come to that later.
The cross cradle is similar to the cradle, except that you hold your baby with the arm opposite of the breast from which your baby is feeding. And that arm is supported by a pillow. Now in this case, you have to support your baby's head with your fingers and thumb on the nape of your baby's neck, just behind the baby's ears. And again, please make sure that your baby's head and their body are in a straight line.
Yes, this position can be super helpful to learn your baby how to latch onto your breast, or when your baby is having difficulties doing just that. So if your baby is premature, this could be a great position for you. And that's mostly because in this position you have more control over your baby's head, since you're supporting it with your fingers and thumb. It is important though that you don't press on your baby's head in case your baby wants to pull away from your breast.
Yes, that said, like the cradle, the cross cradle hold might not be the most comfortable one if you recover from a C-section, a tear, or an episiotomy. And since your baby will be in a more horizontal position than in the normal cradle position, it is also not the best position if your baby suffers from reflux. And there are also better positions if your baby tends to be gassy. In order to feed your baby in a side-lying position, you first need to lie on your side. Use a pillow to support your head. Your baby lies next to you on their side too, facing your lower breast and nursing from your lower breast. Make sure that you support your baby's back either by putting a breastfeeding pillow or a rolled up blanket behind your baby, or by tucking your lower arm around the baby. Moreover, please make sure that your baby's ear, shoulder and hip are in a straight line and not twisted.
Many women prefer this position when they feed their baby during the night because it's easier for them to rest during the feeding, right? It can also be particularly helpful if you have large breasts, because the mattress can support the weight of your lower breast while you can use your free arm to support and guide your baby's head. That said, this position may take some time to learn, so it might not be the best position for beginners, also because it's difficult to see if your baby is latched on well.
Yes, on the other hand, this position can be really helpful if you suffer from hemorrhoids or are recovering from an episiotomy, a tear, or even a C-section, although not every woman feels comfortable lying in a side-lying position right after a C-section. If that applies to you, bear with us. The next two positions can help.
Right.
Finally, please also keep in mind that this is not an ideal position if you try to prevent gas or if your baby suffers from reflux. There are much better ones. For this position, you first need to lie on a sofa or a bed. Make sure that you don't lie flat. Ideally, your back has a recline of about 45 degrees. Also make sure that you support your back and shoulders with pillows so that you are in a comfortable position. And then there are two variations of this position.
Yes, in the standard position, you lay your baby on your front with baby's tummy resting on your own tummy and with the arms hugging your breast on both sides. In the modified position, on the other hand, your baby is lying across your own body, or if this is not comfortable for you, just put your baby on the other side of your body while supporting your baby with your arm.
Yes, and then once in position, you can guide your baby's head to your nipple. Just make sure that you don't put any pressure on your baby's head, just in case they want to pull away from your breast.
The main reason why women love this position is because they can relax while the baby is nursing.
Right.
The modified position can also be great if you recover from a C-section, a tear, or an episiotomy, because you keep your baby away from the area down there, right? Moreover, this is also a great position if your baby tends to be very gassy, particularly if you have a very active letdown, because when you do, your baby is required to swallow very quickly to keep up with the milk flow. And as a result, your baby may gulp a lot of air with the milk. But when you are in a laid back position, the milk is flowing more slowly because it flows upwards, and this can help them be less gassy.
Yes, and when you do have a very active letdown, this position can also be a great help if your baby suffers from reflux, because again, the milk flows more slowly. So if you have a baby who suffers from reflux and is gassy, then this position could be a big help. Just make sure that the level of your baby's head is higher than the level of your baby's belly.
Yes, finally, this is also a great position to feed twins, particularly when they suffer from reflux and or when they tend to be gassy.
For this position, you need to adopt a sitting position with a pillow along your side. Your baby is lying on the pillow tucked under your arm, which is on the same side as the breast that you're feeding from. Your baby's hips are close to your own hips, and your baby's nose is in level with your nipple. Moreover, you need to support your baby's neck with the palm of your hand. And in that position, you can now guide your baby's head to your nipple.
Yes, most women love this position because it is relatively easy to see if the baby is latched on correctly. This position can also be helpful if you have large breasts because your baby's chest supports the weight of your breast. Moreover, you may find this position comfortable if you had a C-section. And it's also the perfect position to feed twins at the same time. And finally, this position can also be great for babies with reflux, as long as you make sure that the level of your baby's head is higher than the level of your baby's belly. That said, it is certainly not a good position if you are trying to avoid gas.
For this position, you first need to sit in an upright position. For example, sit on a sofa. Next, sit your baby directly on your lap or on a pillow on your lap. Your baby's legs are supposed to straddle your body. Next, make sure to support your baby's back with your forearm and to support the shoulders and neck with your hands. This is particularly important as long as the baby is very young, because young babies should not attempt to sit on their own because it is really bad for the baby's spine. So if your baby is really young, you could also use other means to support your baby's back. And then just use your hand to guide your baby to your nipple.
Yes, well, this is not the best position when you recover from a C-section, a tear, or an episiotomy. It is clearly the best position if your baby suffers from reflux, because now your baby is really upright, right? So the level of their head is clearly above the level of their belly. And this can be particularly helpful if you have a very active letdown and a large volume of milk.
Right.
It could also be a good position for babies who tend to be gassy, because this position allows them to control the milk flow much better. And of course, similar to the laid back position, this position is also great to feed twins at the same time.
Yes. Keep in mind that if your baby suffers from reflux or tends to be very gassy, it is also a matter of what you do after the feed. In both cases, you have to make sure that you correctly burp your baby. If you don't know how to do that, watch our video on the most effective burping techniques, which should pop up now.
Yes, on top of that, if your baby suffers from reflux, it is also recommended to keep your baby upright for 10 to 20 minutes after the feed.
Right.
In severe cases for up to 30 minutes. And we really mean upright, like when you're holding your baby to burp them, right? This will help keep the milk in their stomach so that they're less able to spit it up again.
Right. We hope that we could give you lots of useful information on how to support both yourself and your baby with different breastfeeding positions.
Yeah.
If you did find our video helpful, we would be super grateful if you could leave us a like.
Yes, and for more videos on pregnancy and baby-related topics in the near future, subscribe to our channel and hit the bell.